Ever wonder how severe a burn is or how to treat it? Burns are injuries that can result from exposure to various elements like heat, chemicals, electricity, or radiation. They differ in severity, and each degree of burn requires a different level of treatment. It's crucial to know the characteristics of each burn degree and how to administer first aid to aid recovery and prevent further complications. Burns are mainly categorized into 3 degrees based on their severity and the depth of tissue damage, starting with first-degree burns. These burns affect only the outer layer of the skin, the epidermis. They typically result in redness, pain, and swelling. The skin may appear red and feel tender to the touch. Being minor burns, first-degree burns can often be managed with simple first aid measures. Moving on to second-degree burns. These burns extend beyond the epidermis and affect the underlying layer of skin, the dermis. They may cause blistering, severe pain, and swelling. The skin may develop blisters, appear red or mottled, and feel very painful. A second-degree burn becomes major if it is more than 3 inches wide or occurs on certain areas such as the face, hands, feet, genitals, buttocks, or over a major joint. Immediate attention is necessary, and professional medical assistance should be sought, especially for major second-degree burns. Finally, third-degree burns. These burns penetrate deep into the skin, affecting the underlying tissues and possibly causing damage to nerves, muscles, and bones. The skin may appear white, leathery, or charred, and the affected area may be numb due to nerve damage. Third-degree burns are always considered major and require immediate medical attention. Emergency medical care is essential to prevent complications and promote healing. Regardless of the degree of burn, certain first aid steps can alleviate pain and minimize further damage. For thermal burns, extinguish flames and remove the heat source. For chemical burns, rinse the affected area with cool running water. In the case of electrical burns, ensure the power source is turned off before approaching the victim. Cool the burn by flushing the area with cool running water for several minutes. Avoid using ice, as it can further damage the skin. Cover the burn with a light gauze bandage to protect it from further injury and reduce the risk of infection. Over-the-counter pain relievers can help alleviate discomfort. And remember, do not break any blisters that may form, as this can increase the risk of infection and slow down the healing process. In conclusion, understanding the different degrees of burns and knowing how to administer appropriate first aid measures can significantly influence the outcome of burn injuries. Minor burns can often be managed at home with basic first aid, while major burns require prompt medical attention. By following these guidelines, individuals can effectively respond to burn injuries and provide necessary care to those in need.